Okay, today's lesson is going to be on the sexual response cycle, specifically the responses in males. So you should have already watched the sexology video, which gave us a little bit of an introduction into the pioneers in this field, which are William Masters and Virginia Johnson. They were able to really break out and characterize the 4 phases of the sexual response cycle in humans, and we're going to walk through those 4 phases. Excitement, plateau, orgasm, and resolution. And this figure is actually from the original work. Okay, it's got the phases broken out here, and basically what happens during a human sexual response cycle is the individual begins to get excited. There's going to be specific things that we characterize excitement with. They'll move into a plateau period, which is where we level off. It's the point at which you feel like you can't get any more excited. Nothing else is going to increase as far as physiological parameters at this point. However, then orgasm happens. So we experience a characteristic, very stereotyped set of events here. And then we'll move into the resolution, where we basically undo everything we just did and come back to normal. Now with the male response, there's something called a refractory period that we'll describe as well. This is a period in which you cannot enter a second sexual response cycle. There needs to be a resetting and reloading and preparation period before you can go into another sexual response cycle. This is not true of females. So there might be a little bit of time that of waiting that needs to happen before another sexual response cycle can begin. And you don't necessarily have to go back down to 0, like full resolution phase, but there is going to be a waiting period. So you might have to go all the way back down, or maybe you've only come halfway down and you can start a new sexual response cycle. I do want to point out one thing too. Our drive, our desire to have sex is in fact supplied by testosterone. If we didn't have testosterone in our bodies, we wouldn't have any interest in sex and pursuing that. That is true of both human men and women. It is not true across the animal kingdom. A lot of female animals are driven by estrogens, but adult females are driven by testosterone. And we know the source of that to be our adrenal glands, specifically in women who are postmenopausal and don't have functioning ovaries anymore. So we should define a couple terms related to sex if we haven't already. So coitus is simply defined as a coming together. So if we're going to go through this response cycle with a man and a woman, right, we're bringing those two together. This can be described as sexual intercourse. This can be described as copulation. Okay, this is usually characterized by intromission. That is the introduction of an erect penis into a vagina. Okay, one or both persons has an orgasm. Usually what's really characterizing the orgasm in the male is this explosive release of semen. Okay, sexual intercourse, we're going to see it across the animal kingdom, of course. What's interesting about humans is, you know, few animals actually engage in what's called face-to-face coitus. Humans definitely fit that category, and bonobos. And few animals actually engage in coitus for pleasure. Okay, bonobos, again, on that category with us humans, and I saw that dolphins actually engage in coitus for pleasure. Okay. Most animals are strictly undergoing the sexual response cycle for reproduction. That's their goal. Okay. And I do want to point out, too, there's obviously multiple types of sex. We can have heterosexual sex, homosexual sex, different types here. This lecture is really just characterizing sex for business purposes, for reproductive purposes. So we're just going to go through that classic definition of coitus between a human male and female. All right, so let's start with the male responses. Excitement, this is our first phase. This is very obviously marked by an erection. Okay, this is what we're going to see. But there's also some other changes that happen to the penis, scrotum, and other tissues. One of the first things that needs to happen for preparation is that the urethra opening, that external urethral orifice, that's going to widen up, okay, and get a little bit larger so that semen is going to more easily pass through. The scrotal skin will start to change as well. It's going to undergo something called vasocongestion. Think vaso, think blood vessels. And then whenever you think of congestion, don't think of like a stuffy nose where you're all stuffed up and filled with snot, but think of the blood really kind of stuffing up and collecting the area in the scrotum and the penis. So there's going to be increased blood flow in that area, and it's not going to leave. It's going to stay. The cremaster muscle will contract, and that's going to pull the testes up closer towards the body. That's going to, one, protect them and get them out of the way, and also kind of prepare a sexual platform, okay? An area where the penis is going to be able to be inserted, right? That's intromission, and the testes aren't going to get in the way of that. So they're going to lift up and kind of pull back a little bit. This reflex can be activated by a thigh stroke, so touching the skin on a male's thigh region can kind of just get him excited in the mood and trigger that response. It's also triggered by fear as well, but in this situation, it's typically a good thing. It's excitement. Okay, other tissues are going to become erect and excited. There's going to be increased blood flow to the nipples. They're going to become erect in most men. And sometimes we'll see what's called a sex flush. So this has to do with the skin. And there's going to be this response where there's increased blood flow to the skin. And it's not just the skin of the genital regions, but it's going to be on the face, the chest. You'll start to see those areas darken or redden up with blood flow. And then finally, we are often characterizing this with myotonia. Myo means muscle, tone, think like muscle tone. So you have a little bit of increased muscle tone. And your muscles are contracting and everything's kind of a little bit tighter and on alert. Okay, now let's get to the erection and really describe how and why that happens. Okay, so we're going to get vasocongestion here as well. Okay, increased blood flow to the penis, again, paired with less drainage of blood flow. So more blood's coming in and not a lot of blood is going out. And that's really going to get us to the phase where we're going to see the penis stiffen and become erect. Okay. Now looking at these images, we are reminded of the 3 cores of spongy tissue that are within the penis. You have 2 corpus cavernosa and 1 corpus spongiosum. Okay, those are the tissues right here. And the blood vessels within them, those are the ones that are dilating, filling with blood so that we can achieve erection. The penis can be described as tumescent. Tumescent is just a fancy word for swelling. A good kind of swelling, not a injury type of swelling. In order for this to occur, in order to even get into the excitement phase, humans have to be in a relaxed state. We describe that as a parasympathetic state. So our nervous systems, we have a couple different that kind of govern our natural state. So parasympathetic nervous system is really often described as that rest and digest nervous system. Whenever you're calm, you're relaxed, that's usually the state that we're often existing in. So you need to be in a relaxed and not a stressed state or exercising, running away from a tiger, trying to pay your bills. That's going to be a sympathetic state. So we need to be relaxed and parasympathetic to get the right neuronal signals to the penis to get that vasodilation to occur. If that's happening and we're getting the right signal is in fact nitric oxide. Okay, and nitric oxide is really going to be that key chemical that is allowing for those blood vessels to signal to dilate and become bigger and let the vasocongestion happen. The reason I point this out is because you also have some sexual dysfunction reading to do today, so it ties in there. The drug Viagra, Cialis, a lot of these that are now on the market, they are treating erectile dysfunction. And the way that they do it is they're really manipulating the nitric oxide release in the penis. Oftentimes, when people can't achieve an erection, it's because of a blood pressure issue. Maybe you have high blood pressure or some other underlying heart disease or diabetes, that type of an issue, and you're not able to vasodilate and vasocongest in the penis because blood is being sent elsewhere in the body to keep you alive. So you have to make sure you're healthy enough to treat erectile dysfunction if that is in fact your problem, because it's going to affect your blood pressure. Okay, moving out of the excitement phase, and we're into the plateau phase. So basically what is happening here is erection is maintained, and really all the responses that you're experiencing are just going to come up to the highest point that they possibly can. So at this point, your heart rate is up, your breathing rate has increased, your blood pressure is going up, your muscles are a little bit tense. So all of that, it's just a little bit more of that. In the males, then now at this point, you're ready for the pre-orgasmic emission, right, or pre-ejaculatory fluid. Okay. This is when the bulbourethra gland, Cowper's gland in a much older text, that's when these two little guys that are sitting in the membranous urethra are going to do their job, release their few drops of fluid to wash out, right, and clean the male urethra and neutralize any acidic urine or anything that's there. So that should just be a washout phase. I do give a little warning or caveat here that a few drops of semen could be released. The bulbourethra or Cowper's glands do not contain semen, but if this is the second sexual response cycle of the day, there could be semen still in the urethra from the previous ejaculation. So I always caution people, because at some point we're going to talk about preventing pregnancy and those sorts of things. So you should always be careful dealing with any fluid that's released from the penis, because there could be a couple drops of semen in there. Theoretically, should just be bulbourethra secretions though. Okay, then the moment we've all been waiting for, right, orgasm. So this is now going to be kind of a switch over into some of the other nervous systems of the body. Remember, in order to get excited and achieve excitement and plateau, we had to be very parasympathetic, relaxed, comfortable, in a good psychological state. But now we're going to kind of switch over into the action phase, which is almost a little bit like a stress response, because we're going to go a little bit sympathetic nervous system and kind of bring things to a peak. And then we're also going to have to use what's called our somatic nervous system, which is our skeletal muscles, because we're going to physically have to pump the semen out of the body by contracting some of our skeletal muscles. So we will see a little bit of skeletal muscle contraction in our skeletal muscles that have nothing to do with the sexual response cycle. So there might be clutching and clawing of hands and feet, facial expressions, any sort of jerking motions, things like that. This can be part of orgasm. And I mention this just so people feel more comfortable. These are normal physiological responses. It's all written down in Masters and Johnson's notebooks. Heart rate, blood pressure, and breathing rate have come to a peak. If you're one of the people that gets a sex flush, again, the skin around the face and the chest is turning a little bit red or darkening due to blood flow. You will see that. And then we'll get into the ejaculation. So this is a reflex that has two phases, and they have similar sounding names, so be careful here. The emission stage and the expulsion stage. Emission comes first. So this is when we're basically just kind of loading the chamber and moving the semen out of the ductus deferens and into an area where we're going to be able to move it through the male urethra. This is where we're switching over into a sympathetic state, or kind of a heightened stress response state. This is a good stress. And what's going to happen here is we're going to get muscle contractions in the walls of the testes, the ducts, ductus deferens, the glands, kind of pumping and moving everything into place. One really important thing that needs to happen is the urinary sphincter needs to contract. Okay, because we want semen to be moving in this direction out of the body. We don't want any of it going backwards up into the bladder. That's not going to help anybody. This phase is also marked by a release of a hormone called oxytocin. Oxytocin is going to help coordinate some of these muscle contractions in the expulsion state, and it's also referred to as the bonding hormone. This is often why sexual intercourse leads to feelings about people, because of that bonding hormone release. Okay, then we'll move into the second phase, expulsion. This is now moving into the somatic nervous system. So we're going to have skeletal muscles contracting and actually pushing the semen from where it was moved to and settling in the expulsion stage, which is in that urethral bulb of the prostate. And then it's going to push it, right, the rest of the way out of the urethra. So we'll have very rhythmic contractions of the muscles in the penis. Don't forget about all of our pelvic floor muscles. Those are all going to contract and move together to push and expel the semen out of the body. And those contractions are really interestingly characterized as happening at about 0.8 seconds apart. I point that out to you only because we're going to do the female sexual response cycle next. And guess what? Women have these metered contractions at about 0.8 seconds as well. They're not moving any semen, but our bodies are very similar. It takes about 3 to 4 of those contractions to force the semen out of the penis, and then there might be a couple more contractions out of that just following. Okay, finally we are achieving resolution. So basically we're returning back to the resting state. Erection is lost, blood pressure, breathing rate, myotonia, everything just goes back to normal. Okay, sex flush is gone. And this can vary from person to person. Usually it takes about 5 minutes to recover from this, and it can be an additional hours. Really going to vary from person to person for a full recovery. Okay. And again, we don't have to have a complete resolution before we have completed our refractory period. Refractory is also going to vary from from minutes to hours. So resolution is completely coming back down to 0. Refractory is just going to be the time it really takes for the body to recover, to move more semen into place, and for that male body to be able to achieve another sexual response cycle. Okay, so this is just the resetting period. Okay, and then I just want to talk about a couple of variations. So there is this theoretical dry orgasm where no ejaculation takes place. Okay, and that could be good or bad. It could be good if you have so much control over your sexual response cycle that you are practicing what is called coitus reservatus, where you don't have the explosive release of semen and you just enjoy your sexual response cycle, and then there's no risk of pregnancy there. Got to be very in tune with your body to achieve that. I haven't met any men that can do that, and this is supposed to be a method of what I call really bad birth control that is commonly practiced in India. India is currently very populated, so I don't think many are having success using this method of birth control either. Now, the one that might cause more concern is retrograde ejaculation. Right, so we've got semen moving through the ductus deferens, getting pumped back into the ejaculatory duct, and again, we know the desired pathway is going to be out the urethra and out the penis. However, what can happen is if that urinary sphincter muscle does not properly contract, or perhaps if the person has prostate cancer and the muscles have weakened due to any surgery to remove any prostate tumors, what can happen is semen can back up into the bladder. So you won't get any ejaculation there. And then that does pose a problem for infection risk within the bladder. Okay, so you want to get that under control if you have that problem. Okay, and then this is just a summary figure where you can take a look and work your way through the different phases. One thing that I might recommend to do, okay, we've got excitement, plateau, orgasm, and resolution. You might want to just try to narrate out to yourself or take some notes as to all of the things that cause each of these phases and how we can get through this sexual response cycle from start to finish. And then, of course, you're definitely going to be responsible for in being able to interpret this figure and defining each of these 4 phases of the human sexual response cycle.